Pharmacodynamics is a branch of pharmacology and essentially the study of the biochemical and physiologic effects of drugs. In other words, how the drugs affect the body. The effects can include those manifested within humans and other animals. In this video, we will provide a brief overview and introduction of PD. The information presented in this video should not be used for diagnosing or treating a health problem. Consult your healthcare provider before making any changes to your health plan. Remember to subscribe to this channel so you can be notified of more pharmacy and medicine related videos. In Greek, the word pharmakon means drug and dynamikos means power. So that forms the word pharmacodynamics in English. As mentioned before, pharmacodynamics is the study of the biochemical, physiologic, and molecular effects of drugs on the body and involves receptor binding, including receptor sensitivity, postreceptor effects, and chemical interactions. Pharmacodynamics with pharmacokinetics, of which I have a separate video for, which is what the body does to the drug or the fate of a drug within the body, helps explain the relationship between the dose and response. In other words, the drug's effects. The pharmacologic response depends on the drug binding to its target. The concentration of the drug at the receptor site influences the drug's effect. A drug's pharmacodynamics can be affected by physiologic changes due to a disorder or disease, aging process, and other drugs. Disorders that affect pharmacodynamic responses include genetic mutations, thyrotoxicosis, malnutrition, myasthenia gravis, Parkinson's disease, and some forms of insulin-resistant diabetes. These disorders can change receptor binding, alter the level of binding proteins, or decrease receptor sensitivity. Aging tends to affect pharmacodynamic responses through alterations in receptor binding or in post-receptor response sensitivity. Pharmacodynamic drug-drug interactions result in competition for receptor binding sites or alter post-receptor response. So we know that in pharmacodynamics, we're studying how the drugs affect the body. So let's talk a little bit about the specific sites in the body that the drugs can react with or affect. So first, effect on enzymes of the body. You could inhibit enzymes, induce enzymes, meaning make them more active, or bind to them and create a situation where something is inactive becomes active. You also have membrane carriers. Membranes, for example, serotonin reuptake inhibitors, MAOIs, tricyclic antidepressants. You have channels where things like sodium, calcium, neurotransmitters like serotonin, dopamine, they go back and forth. And when you increase that activity, you can force some action. Like for example, in antidepressants, a lot of them prevent reuptake from the synapse, so the neurotransmitters can go through and cause the effect that neurotransmitter should cause. So for membrane carriers, you can have enhancers or inhibitors similar to inhibitors and inducers for enzymes, and you can have releasers where you need some drug or some component to activate the release of some neurotransmitter or chemical. Ion channels, similar to membrane carriers, where you, instead of working on the membrane, they work on specific ion channels like calcium channels, as stated here. So you can either block them or open them to make the chemical go through. Receptors, you can have receptor agonists, receptor antagonists, and allosteric modulators, which can have either a positive, negative, or neutral effect. So when talking about the effects on the body at a more general level, majority of the drugs will either induce or inhibit normal physiological or biochemical processes and pathological processes in animals, or inhibit vital processes of endo or ectoparasites and microbial organisms. Main actions, to summarize, it's They include stimulating activity by directly inhibiting a receptor or its downstream effects, depressing activity by direct receptor inhibition and its downstream effects, antagonistic or blocking a receptor by binding to it but not activating, stabilizing action, where the drug apparently behaves as neither an agonist or antagonist, and direct chemical reactions, beneficial in therapy and also as an adverse event. So the effects on the body that a drug can cause, you're obviously there's a certain goal or indication or certain treatment or certain disease you're trying to treat, but at the same time, when you put anything into the body, there can be some undesirable effects or adverse reactions that that drug can cause. So that is always something we have to keep in mind and be aware of the benefit risk of any product that is given to a patient, given the treatment, given the indication we're trying to treat. Now let's talk about some principles that exist in pharmacodynamics. Uh, PD places particular emphasis on dose-response relationships, that is, the relationships between drug concentration and effect. One dominant example is drug-receptor interactions as modeled by the equation below, where L is the ligand or the drug, R is the receptor, and the LR represents the ligand-receptor complex concentrations. This equation represents a simplified model of reaction dynamics that can be studied mathematically through tools such as free energy maps. Another concept is Emax, or the maximal effect of a drug on a parameter being measured. For example, this could be a measure of platelet inhibition as an ex vivo test, or the maximum lowering of a blood pressure. EC50 is the concentration of the drug at steady state that produces half of the maximum effect. So the E in EC50 is effect, the C is concentration, and 50 is half of the maximum effect. So again, concentration of the drug at a steady state that produces half of the maximum effect. The Hill coefficient is the slope of the relationship between drug concentration and drug effect. Hill coefficient values above 2 indicate a steep relationship. For example, small changes in concentration produce a significant change in effect, and Hill coefficient values above 3 indicate an almost instantaneous all or none effect. KD measures how tightly a drug binds to its receptor. KD is defined as the ratio of rate constants for association, K on, and dissociation, K off, of the drug to and from the receptors. Now, you could have competing drugs, molecules, chemicals in the body that are trying to attach itself to the same receptor. Depending on its affinity for that receptor, the product may be able to bind to the receptor over the other product if it has less affinity. Receptor occupancy: the more receptors that are occupied by the drug, the greater the pharmacodynamic response. So I think that's straightforward. You have a certain amount of receptors, more receptors that are bound to by the drug, you're going to get more of an effect. Receptor up and down regulation: chronic exposure of a receptor to an antagonist typically leads to upregulation, or an increased number of receptors, while chronic exposure of a receptor to an agonist causes downregulation or a decreased number of receptors. So again, talking about the effects of chronic exposure, right, of a receptor. So if you have an antagonist, that will typically lead to upregulation of the activity and increased number of or an increased number of receptors, while chronic exposure to a receptor to an agonist causes downregulation or decreased number of receptors. Lastly, effect compartment and indirect pharmacodynamics. This is the effect of the drug through indirect mechanisms such as inhibition or stimulation of the production or elimination of an endogenous cellular component that controls the effective pathway. So it's not where the drug is directly binding to the site of action. It's stimulating something else that's already in the body, hence endogenous. That will that effect on that endogenous substance will further control the effective pathway. I hope you found this video educational and useful. Please remember to like and share. Thank you.